Hey guys, welcome to the show today. Today, this show is called Aligned for Life. These are the top reasons why it's so important to do just that. Be aligned for life, meaning develop from birth a healthy spine and nervous system so that your body can work at its best. So in this talk, we're going to go over how to ensure that your body's aligned well and the most common issues like colic, bedwetting, ear infections, range of motion issues when you're not, and how to help heal them naturally. So just kind of a quick example of why that's so important. I had a patient come in the other day. So here's the story. We've seen it before. She's a 27-year-old girl coming in to get adjusted in the office. She's got neck pain. She has headaches. She gets migraines. She gets numbness and tingling in her fingers. She has terrible posture. And when we evaluate her and analyze her x-rays, we realize that her spine's really misaligned. And the problem is that she has arthritis that's been in her spine, I don't know, for 15, 20 years. And here's the thing. Alignment dictates the health of your body. So if she has arthritis and it's been in her body building for that long, her body's breaking down faster than it should. So, if you're thinking 15, 20 years of arthritis, she's only 27. These problems developed when she was a kid. Yeah. The problem is as we're adults, we don't really think about what happened when we were a kid. In fact, I asked her, I said, this problem's been here for a long time. Did you have any traumas as a kid? And she looks at me and she goes, no, I don't remember any traumas. And it worked out really well because her 3-year-old boy was in the room. So she had a little baby boy. And looking at her, I said, well, think about it this way. Has your 3-year-old had any traumas? And she goes, oh yeah. And I go, well, let's start from birth. How was his birth? And she goes, well, it was traumatic. I mean, it was, 20-hour labor. I pushed for an hour. When he came out, he had trouble turning his head at first. He had trouble getting a good latch. Okay, there's one trauma. How was crawling and walking? Well, yeah, I'd be lying if he didn't fall a lot when he was learning how to walk and crawl. And now he's 3, so he's at that perfect counter height. Parents, you'll know this if you've got counters in your so house and that perfect height. So she's he's hit his head on that a couple of times. We're learning how to ride bikes. So, you think about it, most of the traumas in our life happen between, 0 to 3 or 4 years of age. And a lot of times those misalignments, those damages, those problems can cause problems in adulthood. And on top of all of those things, I looked over and her 3-year-old was in the room and he was sitting on an iPad with his head just kind of curled in his lap like this. And I was like, that's what I'm talking about. Yeah, you know what I mean?
Absolutely.
So today what we're going to go over is how to start right from the beginning when it comes to health. So from pregnancy to childbirth to infancy, we're going to go all the way up to adulthood to make sure you guys understand the importance of staying aligned for life through each of these stages.
Absolutely. Starting with pregnancy, it's really important during pregnancy to make sure you're well aligned from a mom perspective who is pregnant now, but also in the past. I will tell you that there's nothing worse than going through 9, sometimes almost 10 months of life where you're uncomfortable, you're miserable, things move more than normal.
Yeah.
And I will say though, the thing that's kept me going the longest throughout this entire pregnancy and my previous pregnancy is the fact that I've been getting adjusted every single week. And it's important from a standpoint of making sure that your body and your hips and your pelvis are aligned properly. Because if you think about it, your uterus is anchored to your pelvis through ligaments. And those ligaments attach to bones somewhere. And if your bones are all twisted, then that starts to cause twisting and tension unevenly on the ligaments, which then can cause twisting and tension on the uterus. Yeah. Which affects mom's comfort. It can cause a lot of back pain and back issues, but it also affects baby positioning as well too.
Yeah, it's not a lot of space in there. So
not a ton. No.
You tighten those up, and you went from a 1-bedroom apartment to a studio.
Yeah,
you're getting cramped.
Absolutely. And especially towards the end is even more important for moms. Often we'll get a lot of moms come in towards the end of their pregnancy because they tend to be more uncomfortable, but also because we see things like the baby's breech or the baby's not an ideal, proper, optimal position for birth and for delivery. And so a lot of moms want to have a natural vaginal delivery without interventions. And one of the best ways to do that is to make sure that the body and the pelvis of mom is aligned properly. So as the baby starts to descend down the birth canal, it can dilate evenly, and baby it can speed up the process through which the mom goes through labor and delivery as well.
Yep. Yeah. There's a higher risk for having cesarean sections or for having breech babies if your ligaments are super tight in your spine, if it's not aligned properly. So super important.
Absolutely.
We talk about raising healthy kids. It really starts with the health of the mom and the family before we even go into that process.
100%.
You know what I mean? So,
absolutely.
The next thing is going through childbirth. I was there. I helped deliver both of my children. And you're on number 2 now too. So you obviously had a baby as well. So I didn't get to do that, but I got to help. Super important that as Dr. Marissa talked about before, that you have these relaxed ligaments going into delivery. If your uterus, if the ligaments around your uterus are extremely tight, if you're having a lot of back labors and things like that, it can make labor a lot more difficult. And more difficult labors increases your risk for having to have more invasive procedures done. We know, and research shows this, is the far and away the best way to have a baby with the least risk for any type of harm is to have the most natural birth possible, and that's what all of us want. So making sure that we have as relaxed ligaments as possible gives us the best chance of having a great natural vaginal childbirth. Absolutely. And it's so important to have that, because when a baby is born through the vaginal canal, two really important things happen. Number one, it helps compress the baby's spine. Number two, the actual bacterium from the vaginal canal is what actually helps to inoculate or seed the baby's gastrointestinal tract. Now, it sounds crazy, but our babies, the way that we actually get bacterium inside of our gut is through the birthing process. And so, when we have cesarean section births, what we'll see is that kids have more skin bacterium inside of their gastrointestinal tract rather than the actual bacterium that are inside the vaginal canal, which is the bacterium that we want to be inside of your kid's gut. So when you talk about, proper neurotransmitter development, proper gut health, proper digestion, all of those things, it's so important to have those. And a lot of times, for reasons that we could have avoided, we end up having to go to have a cesarean section or have a more invasive delivery process, which harms our child more, increases the risk that they have birthing traumas, because we didn't do those right things in the beginning. Or it's not for lack of action, it's because we don't know a lot of these things. You know what I mean?
Right.
There's even things now that I wish I would have understood before that point. Obviously, we're physicians and take care of people, but we even learn things going through the process that we didn't know. So you can't feel bad for not knowing, but it's about making sure we understand those things as well.
Yeah, okay. And sometimes C-sections are unavoidable, and sometimes intervention is unavoidable. Like we know that. Sometimes when a mom comes in, especially towards the end of pregnancy, if she's never been under chiropractic care before, and maybe the baby is breech or not in a good alignment, there are certain circumstances where no matter what we do or no matter what you do as a mom, there's nothing that's going to allow the baby to turn properly head down. So there are times and places for those things. Our goal is to try to minimize that added stress, because I talked to a mom yesterday who said her birth was very, very traumatic. She was in labor for about 20 hours and still ended up having to have a C-section after all of that. And she said just the ongoing stress and trauma of healing from the C-section, just the emotional trauma of not being able to give birth to her baby the way she had always imagined and envisioned was really traumatic with her, and it carried on. And that we can see postpartum for moms, it can lead to things like postpartum anxiety, postpartum depression, and that affects mom's bond with baby as well too. So sometimes it's unavoidable, but the more we can do to improve those outcomes for mom and baby, the better off and the happier everybody is too.
Yeah, 100%. And the last thing too is making sure that we have a good birthing plan going into it. Whether you're having a home birth, whether you're having a hospital delivery, whatever you decide, have things written down. We were one of the rare people who had, we decided on a home birth and got transferred to a hospital. And I made sure that we had a great birthing plan, because it matters. A lot of times your agenda may not be the doctor's agenda that is attending. You may end up getting an intern who just got on shift and wants to do things their way. And so you need to be really, really vocal, whether if you have a birth plan for shots or for no shots, you need to be able to say that right in the beginning and be firm on it, because you're going to get pulled a lot of different directions when you go in there, and you want to make sure that you understand exactly what you're getting and doing the right things to make sure that your baby's the healthiest possible.
Absolutely. So. And knowing and having that and talking that over with your partner or whoever is going to be in the room with you is super important, because moms, I will tell you, when you're in the moment and they're asking you, oh, hey, why don't you just take this drug? Guess what you're going to say? Yes, please.
Yeah.
Like, I don't want to suffer. I don't want to be in pain.
Yeah, you just finished an 8-hour workout. You know what I mean?
At least, yeah.
Yeah, you need to be prepared going in.
Yeah, so making sure everybody in the room is on board with it as well, so that way you don't have to make that decision in the moment, and you have it already pre-planned. Awesome. The second thing is, or the next thing to talk about is really then infancy. So once baby is born, it's really important to make sure that baby is checked for spinal misalignments as soon after birth as possible. Research has been done time and time again that shows 80, sometimes up to 90% of all infants born have some sort of spinal trauma and misalignment to their spine. Yeah. Traditionally, we see it at the top of the neck, but we also see it at the lower part of their back and their sacrum at the very base of their spine as well too. So by getting them checked right away from birth, you think about even if mom wasn't getting adjusted during pregnancy, or even if she was, like my daughter, when she was born with torticollis. So her head was tilted off to the side. Her jaw was off center. She couldn't latch properly. Caused a lot of stress for baby. It caused a lot of stress for us as well and for mom. And by some things that we can't avoid, like that was a lot of positional stuff in utero, but also the birthing process. As she was being born, she actually turned back to back. So she was posterior a bit and caused a lot of back labor. And that affects the formation, like you mentioned earlier, of their spine and even the cranial bones. And if that's not addressed right away from birth, that can lead to longer term effects with baby. For example, babies might start developing flat spots, or they might have continued problems with actually latching on. Making sure that having that proper alignment too helps with their neurological development. So we talk about reflexes. Babies are born with certain reflexes like the grasping reflex, where you put your finger in their palm and they automatically grasp. Or the sucking reflex, where you scrape the side of their cheek and they naturally try to root that side because they know it's time to eat, sort of thing. So making sure that those reflexes are properly integrated as they age and get older. You don't see a lot of adults walking around where you wipe the side of their cheek and they like go over like they're trying to feed or nurse. But making sure that those are properly integrated now early on will actually make sure that as they're learning to form sentences, as they're learning to talk and walk and develop different things and focus attention, it helps to make sure that those are functioning as best as possible.
And so that's the big thing, is like when babies don't, when they have a birthing trauma or they have these neurological problems, babies can't communicate. So it's not like they can turn to you and say, Mom, Dad, I have pain, or, I feel like I'm misaligned here. Like we can kind of understand and notice as adults. So what happens? I mean, they start developing these neurological issues. It's their way of telling you that there's a problem. They're crying a lot, which is also known as colic. You talked about torticollis, which is where a torticollis is where they have improper range of motion. They can't turn left or right, up or down properly. That's all called torticollis or Ryeneck. My first son, had that as well at birth. They can develop ear infections more commonly. They can have sleeping issues. They become neurologically imbalanced. So their body gets pushed into this stressed or this fight or flight state where they can't relax. They can't calm themselves down. This is where they start missing milestones. They can develop sensory issues, and really all of those, cause our body to adapt to not being in our best state possible. And it's frustrating for parents because
it's hard.
You know what I mean? A lot of times we don't have these other natural solutions and we don't know about these. And so what do? We turn to medications. So, as soon as our kid develops colic or reflux or ear infections, we say, oh, I don't want to give my kid medication, but I don't have any other thing to give them, so I'm going to. So you know what I mean? So we start with antibiotics from birth, or we start with acid reflux medication and all of those things. And we know that the more you do those at birth, it drastically inhibits the body from developing properly from a gastrointestinal standpoint, from a neurological standpoint. We know that giving children lots of antibiotics from birth affects their ability to fight off infections later on in life, because you're not allowing them to develop that healthy immune response within their gut by developing that really healthy gut flora and bacterium. So really important to work on keeping your baby functioning well as much as possible, getting them checked, making sure that they develop these milestones properly, proper reflexes, proper turning, proper sleeping. That's how you're going to really give your baby the best shot of developing into a really, really healthy adult.
Absolutely.
Right? So,
and even those little misalignments, like we talked about, with affecting their ability to latch on and develop their gut. We know that breast milk by far is far superior in helping to make sure the gut is healing and actually developing properly. Again, I know sometimes there's time and circumstances for formula, but if you can ever at all supplement breast milk with yourself or with a donor breast milk supplier, that's going to be far more superior.
Yeah, that's your main shot. That's what you want to always go for. There's always times, but yes, main shot is for that.
Absolutely.
And it's, some people talk to me and they say, well, it's not true that you're born with this perfect, healthy, aligned spine and body. So a lot of times I talk to parents and they're like, gosh, they're frustrated. Like, I didn't know this stuff could happen. I just thought we were born perfectly.
Right.
And it's like, we're born perfectly. We're born in God's image, but it doesn't mean the fact that we don't have traumas along the way, And so one of the big things is you have to understand that we as adults have developed these adaptations in our spine and in our body that prime us for a good, long, healthy life. When we're in utero, we're basically one big giant C. When we come out of the womb and we're new babies and we learn how to pick our head up and start holding our head up for the first time, that's where we actually develop this curve or this arc in our neck that neurologists now call the arc of life. We know how important it is to long-term health. So we develop that curve in our neck from 0 to 6 months. So, if we're not developing properly, we can lose the chance to develop that proper curve. When we learn how to sit up, that's when we develop the curve in our thoracic spine. So being able to hit that milestone and get sitting, extremely important. We talk all the time about not using the bouncer thing, the jumpy things that overdevelop kids' legs, because they have to develop these curves properly in their spine in the right order.
And the right time as well, too.
Absolutely.
If we try to put babies into these positions before they're ready, that actually can have a bigger traumatic effect on their spine and overall growth and development down the road.
Yeah, they're bouncing in their spine when they're 6 months and they should just be learning to sit up. And now they're overdeveloping their legs, or they're compressing their spine when their body's muscles aren't ready to support that. So it's cervical curve first. They're looking up, moving around. Next, they're sitting to develop the thoracic curve. The lower lumbar curve. In your lower back, we develop between 12 to 18 months of age when we first start to learn how to walk and learn how to eventually run. That's the order for us to develop these curves. And we know that if you develop these proper curves in a healthy manner, if you're well aligned for life, your spine should last 120 to 130 years. Okay. We want to give our bodies the best shot at developing that as humanly possible. You miss one of these curves and you're taking 20, 30 years off of the life of your spine. You know what I mean? And then you sit in school for 12 years or 15 or however many years. You have all these traumas. We have
looking at phones and things all
we
day
have 21st century trauma with all of these technology issues.
Yeah.
And it's no wonder that our bodies are breaking down in our 20s or 30s or 40s. You know what I mean? For myself, for my kids, we want to give ourselves the best chance to go forward. So that's why we talk about ensuring this proper spinal development from the start.
Absolutely. And just kind of to touch on that too, they're called milestones for a reason. They're not mild suggestions. You have to hit all of those. So, that's awesome if your child is walking early, but at the same time, you have to make sure that they crawl.
Yes.
It's very important that they actually go through that crawling, that cross crawl movement.
Yeah.
Like I'll tell moms all the time when I'm checking them in the adjusting room, when they're on their back, I said, well, make sure even when they're, 4, 5, 6 months old, start doing that opposite cross crawl movement. So take, let's say their right arm and their left foot and try to bring them together and just do it a couple times, maybe 5 sets of, or 10 sets or 10 repetitions, and then switch other side. So even though they're not crawling at that stage yet, they're still trying to turn over. It actually starts help developing their brain and connecting both sides of their brain.
Yeah.
So that helps them be able to actually crawl faster, crawl more efficiently, and like you said, develop all the spinal curves. Talking about some of the most common issues that kids and babies that we see, we mentioned and talked about colic. Guys, moms, dads, colic is probably one of the most stressful things that we can experience as parents, as new parents, especially for the first time. When my daughter came out with all these issues, she was very colicky, very fussy. And it's hard. It's exhausting. It's physically traumatizing for mom, but also for babies as well. And nobody wants babies to cry. We all know that they will cry. But between 10 to 30% even, or even more of all young babies suffer from what's called infantile colic. And so that's usually an unexplainable crying that most pediatricians and most people will say, well, we don't really know what's causing it. And we're still trying to understand and figure out. I think there are multiple causes with it. But it can last for hours. And if any parent has ever gone through this, if your child, everything else is perfectly healthy, but they won't stop crying. They're just constantly fussy all the time. It's very stressful. And there was actually a study done in 2012 where they took babies 8 weeks and younger, and they found that those babies who received chiropractic adjustments on average cried 2 to 3 hours less per day than those who received where they just kind of touched their back and actually
a placebo,
adjustment basically. So that's after just 10 days of chiropractic care for these babies.
Wow.
That's less than 2 weeks. So you imagine the 2 weeks that it takes to put into that versus the weeks and months of the crying and inconsolableness.
Yeah, I don't do well with no sleep.
No, me neither.
Everyone does this.
Imagine what that 2 to 3 hours a day of silence could mean for you and for your baby as well.
Absolutely.
So if you are suffering with that with your child or know somebody is, make sure you get them to a chiropractor, come to a CS. Next thing too to talk about is bedwetting. So kind of looking at older kids even, we all know that kids are going to wet their bed at some point in time, especially as they're potty training and they're learning how to use the toilet. And you're learning how to listen to their body to know, hey, it's time to go to the bathroom. However, though, sometimes that persists as kids get older. 8, 7, 8, 9, 10-year-olds as well sometimes develop this chronic issue. It might not seem like a huge deal for some because many people think, oh, well, the kids will just grow out of it. But for the child, that can actually be very emotionally traumatizing for them.
Yeah, no sleepovers.
No sleepovers, no
a lot
camps,
of insecurity. Yep,
very
absolutely.
insecure. Even just having that shame, because I think sometimes parents are like, well, what's wrong? Like, you're old enough, you should be able to get up and know when you have to go to the bathroom. And there's some research that suggests, too, that there is a physiological reason though that this happens for parents, or for kids, I should say. And that's when we look at the underlying issue with that miscommunication between the brain and the body. Basically, your brain and your body connects via the nervous system, right? And so for your body to know that your bladder is full, there's a signal that has to communicate.
Yep.
What we found in a lot of kids with bedwetting is that communication is not quite fully there. And what they found through research is they found that kids who've actually been adjusted have experienced less or 50% a reduction in bedwetting incidences.
Yep.
Because what it does, and that basically this is what chiropractic does for everybody, guys, is it helps to better communicate the brain to the body. So it can recognize when there's something that's not working properly, or it can recognize when it should do something properly, like my bladder's full. So when the communication is there, the brain will wake up the body, the child goes to the bathroom, and then now the child's starting to grow out of it and starting to develop properly.
Yeah, and we had this happen literally just last month in our office. 9-year-old girl comes in. She's been struggling with bedwetting her entire life, from, age 3, 4, 5, when kids should normally become, safe and dry through the night. She didn't. And she was so frustrated that as she came into our office, I'm sitting with the mom and she won't even talk to me about it. She has to leave the room because the daughter doesn't want anyone else to know about it. It's such a self-conscious thing. And so she had a lot of rotation in her pelvis. Same thing we're talking about. So the base of her spine was shifted. That can create a lot of tension through there. Didn't have pain, but just we saw it on x-rays that her spine was shifted out of alignment. We started relaxing her spine through adjustments. You got to think the ligaments relax through that area. And then as you get better mobility through there, you get this better brain-body communication. 6 weeks into care, I'm doing a reevaluation with her, talking with the mom, and like, how's she doing? Is she having dry nights? And she's like, oh, I forgot to tell you. Like, she's worn out her pull-ups and is not going in them at all. So she will wear the same one just over her underwear, and she's having more dry nights than ever before. She hasn't had an accident in 4 weeks. That's amazing. You know what I mean? And it's like one of these things that you'd never think about, growing up. I was a bedwetter growing up, and I wish someone would have told me, my parents, about this, because I didn't have sleepovers until I was like 10 years old because I was afraid to go anywhere. You know what I mean? So,
and it's important to understand we're not treating bedwetting. Right? We're not treating colic. We're not treating these conditions.
Right.
What we are doing is we're trying to improve spinal alignment with the aim of improving the child's brain's ability to communicate.
100%. Absolutely. We're trying to fix the cause, not treat the symptoms.
Right.
Absolutely.
The next thing, looking at ear infections. Parents, if you have a child, most of you probably have experienced ear infections. And kids are more prone to ear infections in general because when you look at the canals inside our ears, as we're born and when we're babies, they're more horizontal. And then as we grow into adults, they start to angle, I should say this way, more backwards. And so when things are more horizontal, it's easier for fluid and bacteria and things to stay trapped in there. Most ear infections are triggered by a viral infection. Even though when you go to the doctor and they look in the ear like, oh, yeah, the child has an ear infection, the first thing they try to do is give them antibiotics. Oh, yeah. And sometimes in some cases, again, that's necessary. But for the most part, if it's a viral infection, we would never give an antibiotic for a viral infection because we know it does absolutely nothing. If it's a bacterial, then we would. But viral, not so much. But most doctors don't take the time to actually test to see whether it's actually viral or bacterial. So then we look at what do we do for this child now? One of the biggest things we see with parents, they bring their kids in, is getting adjusted because that affects their immune system. when their immune system is compromised or it's downregulated because of spinal misalignment, bad gut, bad diet, different issues like that. When we adjust the spine, it actually helps to better improve the immune system function. And we find that kids tend to have less ear infections. They get over it a lot faster. I will say I've been adjusted since I was 2 weeks old. I've never had an ear infection. My daughter was adjusted since birth. She's never had an ear infection as well too. And if you do get antibiotics for your child, what that does though is it actually then affects their gut bacteria. And we talk a lot about the gut because that's a really important part of your immune system.
Absolutely.
It's called your second brain for a reason. So when you affect your gut bacteria and the gut lining, it kills with antibiotics, it kills all the good bacteria as well as the bad bacteria. So then it actually sets the child up for more reoccurring ear infections, which then means usually more antibiotics and more pain.
Tubes in your ears.
Eventually, tubes in the ears.
Goes down the line. And so I wasn't adjusted, so I actually had all of those things.
Yeah.
Several rounds
Not
of
that it's bad,
antibiotics. Well, no, I mean, like, I look at it this way, and like, my kids have never had an ear infection either, and like, they've never had an antibiotic. And I think about myself and all the different immune things that I went through and understanding the research now of like what I went through. And it wasn't that I had bad parents. It was that they didn't know, they weren't educated.
Absolutely.
You know what I mean? And so now that I understand this, the effect of long-term antibiotic use in children and the effect of getting tubes in the ears and the effect of not being adjusted well and have your body functioning well, it's huge when it comes to that exponential effect that it has on your 20s, 30s, 40s, 50s. You know what I mean? The better way that we make healthy adults today is starting with healthier kids. And that's one of the most important things. I think oftentimes we neglect it because we're so maybe sleep deprived as parents, or there's a lot going on in our lives.
Well, and you think about it, we tend to, when you're expecting a baby, we don't usually think about after pregnancy. All mom and dad are thinking about is during pregnancy, prepping for baby when baby comes, getting the nursery ready. Very little time, I will say this from experience, is actually spent thinking about, well, what am I going to do for my child? Like, what kinds of foods are they going to eat? When are we going to do that? Are we going to give them the shots or not? Are we going to, do baby-led weaning? Are we going to do any of this stuff? What happens if they get an infection? Like, what are we going to do with that? Like, what is our stance on that? And so I think the more that we can start thinking ahead of time, parents, but even not beating yourself up if you didn't know, like your parents clearly didn't know, and that's okay. And that's why we do this, is to help you inform, to make better decisions moving forward. Yep. And most importantly, to help others who are in that same position or maybe expecting, in order for them to start thinking, hey, maybe you need to start thinking about what your plans are when this happens with your child.
Yeah, and know that we're on your team. You know what I mean? So developing this good doctor team around you of natural-minded physicians who can really help you. If you're local in Columbus or in the Powell area, we've got a lot of resources for you guys to make sure that we give you guys the equipment that you need to be there, because you're still going to have to work 40 hours a week and do all these other things. Let us help you kind of weed through the stuff so you can get the best results. Okay?
Absolutely.
Let's talk for a minute just on adjusting kids, because I know that whenever we start talking about this, there's a certain percentage of parents that will come in who are actually really nervous, I guess, about having their kids adjusted. Even some patients who go to get their kids adjusted are nervous, saying like, well, are you going to adjust them as hard as you adjust me? You know what I mean? Like, I see how you adjust me, and sometimes it's rather rough. No, first and foremost, no. Adjustments for kids are very gentle. And I would even argue for adults, we only adjust someone as hard as is necessary to get their spine to move into a better alignment. So it's never like we're trying to beat anyone up intentionally. Right. But developing spines don't need to be moved as hard as adults. You got to think about it, especially like if you're just born. I mean, we need the force of our pinky essentially just to wiggle the spine back into alignment. So when it comes to adjusting, understand, number one, it's very safe. Number two, we're always being gentle, making sure we deliver the right amount of force to get the spine aligned properly. The next thing I want to talk about is how we actually evaluate kids and like walk through everything with them.
And just kind of real quick to touch on
Sure,
what that's like as well for parents and for kids. The adjustment is like, imagine you've got a tomato and you're checking the firmness or the ripeness of the tomato. That's the pressure that we often use with things like that. And the adjustments can be a little long because you're sitting there and it doesn't look like we're doing anything, honestly. Usually the babies, especially the babies, they usually sleep through the entire thing. Like sometimes they kind of move around a little bit if there's an area that's out of alignment. And then all of a sudden you just see this amazing, like everything just kind of relaxes in their body. And then they go back to sleep, if they do kind of wake up for a second. And it's just amazing to see the difference and the change because it's literally like instantaneous with babies and kids. So it's much, much less force, like you said, but just imagine you're squeezing that tomato. That's really the type of force that we're using. Sometimes as they get a little bit older, we have a little activator. It's like a little clicker that we use. And for some of you, we've used that as well. And again, it's a very low, gentle kind of force that we use into the area of the spine that's ever misaligned. So the sooner you get them in, the less work that actually has to be done later on too.
Absolutely.
So yeah, when it comes to evaluating, now obviously it kind of depends on the age of the child. We're not going to throw your newborn up in front of the x-ray machine and take a picture of their spine unless there's something really, really wrong that we think that warrants that. But for the most part, we have to look at really kind of what's going on the inside. We look a lot with posture, especially with young kids. Posture tells us a lot. Posture is like the window into the spine. So I use this analogy a lot. If you look like from the outside, if you're standing a little wonky like this, chances are the inside's going to be a little bit wonky as well too. Yeah. So we look at posture a lot. We do sometimes some x-ray evaluations to help us see exactly where there's trauma, where there's damage into the spine. Again, usually that's a little bit older child. But then the biggest thing that we use is our fingers, our hands. So we do a lot of palpation is what it's called, where we feel along the back, feel along the neck. We feel along the cranial bones as well in babies and infants, because all of their cranial bones are still movable. Up until we're about 1 to 18 months or so, our cranial bones are still moving. You have that little soft spot that is in the top of the head that is there until about 18 months to 2 years old. So we're evaluating those things as well. And that's really what that looks like. And the goal with it here is to check for imbalance. It's to check for misalignments, or it's called a subluxation, to help restore proper function. With babies and kids, I mean, sometimes parents do bring them to us because they have a specific problem. I mean, there are times when, again, colic, reflux, ear infections, asthma, things like that. Very rarely will parents bring their newborn to us because of pain. They can't communicate that kind of stuff with us.
Right.
As the child gets older, if your child does have pain or is complaining of any sort of physical musculoskeletal complaint, headaches, neck issues, back pain, parents understand that is not normal. Like, kids should not have pain like that. That's a clear warning sign to get them in and get them checked. But a majority of our patients and kids that we see in the office are there for a preventative wellness purpose.
Meaning they have no symptoms.
Exactly.
They are otherwise what you would call totally healthy, and they're still getting adjusted.
Absolutely. And you continue doing that. Like my life, I continued getting adjusted when I was a kid because my mom told me to do it and took me. But I continued when I was in college and throughout high school or chiropractic school and obviously beyond, because the difference that I felt in my body and how it made me feel. I felt better. I didn't get aches and pains. I slept better. I just overall felt really good. And I think once you start realizing how good should feel, you start making decisions that take you towards that, as opposed to decisions that take you away from feeling that way.
Yeah, absolutely.
We just kind of get used to, I think, feeling crappy and bad.
Yeah, 100%. We want to reduce the subluxations or the misalignments in the spine, and then once we get your spine really healthy, the goal is then to keep it healthy for a lifetime.
Yeah.
We are not going to live in a glass bubble where we never have traumas or injuries or stress or traumas or what have you. So staying ahead of it is one of the most important things. And we've talked, if you've watched any of our videos before, we've talked a lot about research on this, that basically the healthier your spine is, the better you function, and actually the less you spend on out-of-pocket healthcare expenses. So someone who's had their spine adjusted for 5 years or longer, they spend 69% less than the national average on out-of-pocket healthcare costs, and they take 85% less medications. It's definitely worth it to
100%.
prevent versus treat whenever you have all these problems going on.
It's an investment. Either way, you're investing your money.
Yep.
Either you're going to invest your money in the short term, in the beginning, or you're going to invest it later on when you lose your health because you didn't do the proper things to take care of your health.
Yes. There's always that saying, you can give $1 to the farmer or $10 to the pharmacist. You choose.
Yeah, there you go.
Yep. So just so you guys know, we're absolutely here to support you through this journey. And we are so excited to see you and your family get and stay aligned for life. If you guys have questions or want more information, the best way to do it is to contact our office. We offer free consultations if you ever need help to see how we can help you or your family. Online, we're on YouTube, we're on Facebook, type in Riverside Family.